Hey guys, this is Gabe here. So I'm going to talk to you today about Clostridium difficile colitis. And this picture here is just a picture of the pseudomembranes inside the colon of someone infected by this infectious disease. Okay. So Clostridium difficile is gram-positive, it's rod-shaped, it's anaerobic bacteria, and also forms endospores, hence the name difficile. It's very hard to kill once it gets well established. So, taxonomy: kingdom Eubacteria, phylum Firmicutes, class Clostridia, order Clostridiales, family Clostridiaceae, genus Clostridium, species difficile. Again, pretty straightforward. So, Clostridium difficile is actually a part of your normal microbiota of about 5% of the population. But about 20 to 40% of hospital patients actually harbor Clostridium difficile. The reason for this is that it doesn't really cause the disease just because you have it in your colon. So you get this through ingestion, through the digestive tract. These spores can end up on anywhere in the hospital, on gloves, on rails, on whatever. But again, it's only when the bacteria completely take over the gut that it becomes dangerous. So just because you have the bacteria doesn't mean you're going to get sick. So the causes of the disease itself are actually relatively unknown. It's a topic of really hot research right now. So somehow it knows that it's the only bacteria in the area. But regardless, you have to have the bacteria to contract the associated colitis. So broad spectrum antibiotics that's the usual pathway it leads to it. But the broad spectrum antibiotics like penicillin, things like that, they can kill off the other good bacteria in your gut and leave Clostridium difficile to take over. And again, that's going to end up you're going to end up with a disease. Also, something interesting is that antacids along with the antibiotics actually increase your risk a little bit. No one really knows why. And it's also sometimes associated with inflammatory bowel disease, and you don't have to take antibiotics in that case. And it can also sometimes even happen spontaneously if you get really unlucky. It's kind of unknown the full reasons why it ends up taking over or ends up causing the disease. So, once Clostridium difficile understands or realizes it's in charge somehow, it becomes the boy on the block and starts releasing toxin A and toxin B, which are the things that really end up causing the diarrhea and the rest of the symptoms. Toxin B is inactive until it interacts with toxin A. Toxin A creates holes in host cells, and toxin B damages the cytosol of host cells. And actually, there was a study done on these toxins, and if the genes for these toxins are taken out from the bacteria, it actually becomes much less virulent and doesn't survive as well for whatever reason. So the main symptoms of C. diff are abdominal pain, fever. You can actually get a very high fever. Can be very dangerous in severe cases. Main thing is diarrhea and blood and pus in the stool. Ulcerative colitis, you can get a lot of ulcers in your colon, put holes in them even. You can even get a ruptured colon. It's pretty serious, and it's a very long-term illness, actually. It can last, 30 days up to a year even. It's pretty severe. The other scary thing is that the disease is actually becoming a lot more prevalent in hospitals. Between 1993 and 2009, it really skyrocketed for whatever reason. In 2001 is where it kind of seems to start. The peak was about 2008 on this study, where almost 350,000 people had it, and that was just the people that came to the hospital for it. Alright, so there needs to be some treatment for this because it's a pretty nasty thing to have. So probiotics are actually suggested by doctors for prevention, but there's really no good data for that because the money's just not there, because it's more of a preventative measure. And it's kind of hard to tell what that can actually do over the space of decades. It's pretty new. Probiotics, as you well know, are a pretty new and trendy idea. But what they mainly use is antibiotics right now. Usually vancomycin and metronidazole. The problem with these is that there's actually about a 25% risk of recurrence after using these. There was a study in Quebec a few years ago, about 2004, 2005, and they looked back and they saw that recurrence for people that were treated with just metronidazole in 2003, 2004 were actually almost 50%, which is not good, compared to 1991 and 2002, which is 20%. So it's more than doubled, which made them think that the Clostridium difficile has actually mutated a little bit in the past few years. It's become a lot more resistant to these antibiotics, which is the danger of antibiotics. And it's also actually become a lot more, the mortality rates increased as well. So again, it's probably mutated. Also, these antibiotics make you feel pretty ill, abdominal cramps, diarrhea, headache, nausea, vomiting, which you're already getting from the Clostridium difficile colitis. Also, the prices are pretty high for these antibiotics. So, the newer treatment for this, that actually my dad, who's a gastroenterologist, has been using lately, is, oh, excuse me, we're not there yet. So, there needs to be a new treatment, is the point. It's, the treatments now are not really effective. So the mortality rate for this is currently about 7% after 30 days from the diagnosis, and about 16.7% about a year after the diagnosis. So as I mentioned earlier, it's a long-term illness. It's really nasty. It can really bring you down. It's not good to have. So mortality rate, again, is started to increase about 2001, just like in the Quebec study found about prevalence earlier. This is deaths per million of the population, not necessarily strict mortality rates, not a percentage of people that have the disease. So it peaked at about 2004, and at the end of this graph, where 23.7 people per million were dying from this illness. Some new treatments out there are really exciting, actually. They're kind of gross, but they work. It's what's called a fecal transplant, where they take healthy stool from the colon of a healthy individual, and they put it into the colon of the infected person. There's two ways to do this. There's the pill form, which is a lot cheaper, and they can also do it during a colonoscopy. Basically, they do a colonoscopy, they check inside your colon, look for those pseudomembranes, and then on the way out, they actually spray the liquid stool in there. Basically, this is the equivalent of bringing back the posse of good bacteria that you lost. And they basically put the bully on the block, this Clostridium difficile, back into its place. It's actually extremely effective, between 90 and 97% effective. And so far, there's been no reported side effects. So, that's it. Thanks.